right, so thanks for tuning in today. I'm really glad that Island Prostate Center has continued to have virtual meetings. It's so great to see everyone connecting over technology these days. Today, I'll be presenting how to enhance intimacy and sexual adaptation following prostate cancer treatment. And for those of you who I may have seen in my clinic or in our education sessions, just know that this presentation will be a little different from what you may have already seen. And as this is already mentioned before about the Vegas rules and confidentiality, same goes, and medical concerns, just so you're aware, should be brought to your doctor, as I may not be able to address some very specific questions. So I may have to refer you to a one-on-one appointment or back to your healthcare team. And as already previously mentioned, if there's any questions, feel free to just type them into the box. I'll try to make sure I take a peek at them every now and then, but feel free to send me a wave if I'm not noticing your attention. All right. So I'd like to introduce you to John and Martha. John is 70 years old. He's a loving father of 3, been retired since 2015, and he and Martha have been married for 45 years. And John was recently diagnosed with prostate cancer last year. And this came as a surprise to him, as he's always considered himself a healthy guy, and this was his first cancer diagnosis. And John and his doctor decided a prostatectomy, or removal of the prostate, was the best treatment for his cancer. He had his surgery and recovered well with a few side effects. And after he had his surgery, he noticed his relationship with Martha had changed. They were no longer as close as they once were. He felt ashamed that he could no longer perform as he once had before surgery. He wanted to be able to please Martha and thought, why start something I can't finish? Soon they had lost all types of intimacy in their relationship. And she wondered, why doesn't he feel attracted to me anymore? What am I doing wrong? And the couple never discussed their unhappiness, as they were afraid it would embarrass or hurt the other person. And one day, Martha sees a flyer for a talk about intimacy and sexual adaptation, and she thinks, why not? It couldn't hurt. They attend the group session virtually and learn about all the ways they can enhance their intimacy and rebuild passion in their relationship. John and Martha overcame the challenges of prostate cancer treatment, and they continue to build a loving and intimate connection together. While their sexual relationship isn't the same as it used to be, they've developed an entirely new way of being together. John tells me that they've reignited the passion in their relationship, and they're closer now than before his diagnosis. So this story is one of the many scenarios couples can face when going through prostate cancer treatment. Prostate cancer treatment can create an opportunity for change in your usual way of being sexual or intimate. And today I hope to share some knowledge with you that will help to empower you in your journey. And we'll look at ways to enhance your intimacy and sexual functioning, regardless if you're in a relationship or on your own. So let's first take a look at what intimacy is. Intimacy is an umbrella term for that affectionate or loving personal relationship with another person. It's that closeness you feel with someone. And there are multiple dimensions that make up intimacy, and it's very powerful to share with another person. First, you have your intellectual intimacy. That's a rich meeting of the minds. They're your thoughts, ideas, your connection on values. You have your experiential intimacy. That's your closeness in activities, what you do together that you enjoy. Sexual intimacy are practices of sexual relationship with a partner. And you have your emotional intimacy, which is how you support each other, being vulnerable, and having those feelings of closeness and trust. There are many ways of being intimate with one's partner, and it's important to communicate what dimensions of intimacy are important to you and how to maintain that closeness throughout your relationship. And taking a closer look at that sexual intimacy, as there are many components within that. Sexuality is the essence of who we are as unique individuals. It's how we express ourselves, what brings us joy and pleasure, and it encompasses all the feelings, attitudes, and behaviors that contribute to our sense of self. So this is what I call the wheel of sexuality, and it shows the diversity of our sexuality. So take a look at these words. What influences your sexuality? What makes you feel like a sexual person? It's important to recognize where our feelings of sexuality come from and to understand that there are many components. You've probably heard or have already experienced that treatment for prostate cancer can affect your sexual functioning. All of these can be consequences of treatment, and they can change your usual pattern of being sexual and feeling close with your partner. And when your usual pattern of being sexual has changed, this requires adaptation. And the process of sexual adaptation can be challenging. It's important to reflect on these 4 principles to help you move forward. Having acceptance and how things may have changed in your functioning or in your relationship, being flexible in trying new things and having change, and then remembering to have patience and persistence. How many people here have learned how to ride a bike immediately the first time they sat on one? It takes patience and persistence to learn something new, just like anything in life. So today I'll share a few strategies that you can put in your toolkit and re-spark that romance and loving connection with your partner. And if you're single, just know that all of these apply to you and focusing on your own sexual health. So I find a lot of the time couples can be focused on erectile dysfunction treatments as they want to engage in intercourse again. And there's nothing wrong with wanting this. Yet it's important to remember that there are many ways of enhancing intimacy in your relationship. And try not to focus on just one way of enhancing intimacy. But first, let's take a break and look at some Mythbusters. There are many common myths in our society that can affect our way of being sexual. So let's see if you can guess if this is fact or myth, and feel free to put up a thumb for fact and put down a thumb for myth. So for the first one, no erections equals no sex. And it is a myth. There are many ways of having sex without an erection. Oral stimulation, mutual masturbation, stuffing. Sex does not mean only having intercourse. Very common misconception. Partners are not affected by the experience of prostate cancer. That one is also a myth. We always say that prostate cancer is a couple's disease, as research shows it can affect the partner just as much as the person with cancer. Sexual recovery can take years. Also a fact, most of the time for prostate cancer, recovery is a long journey. It's all about finding what works for you and being able to adapt to changes along the way. People with cancer do not want to have sex. Another myth, sexual health is important to everyone, regardless of having health challenges. People want to have that closeness and connection. And then last one, and this is the most common myth. That's right. Most people don't know that you can have an orgasm with a flaccid penis. And if you need more information about how to have intimate play with a flaccid penis, let me know and I can give you some more information. So coming back to our toolbox, let's take a closer look at some of these strategies for enhancing intimacy. And the first one we're going to look at is communication. Communication is the best way to enhance intimacy and increase sexual satisfaction in your relationship. Here are some tips for talking to your partner about sexual problems. We often think that we know someone so well we can read their mind, but this isn't true and research has proven this. It's important not to assume how your partner feels, especially when it comes to sexual dysfunction. Remember in the beginning story when John wouldn't talk to Martha because he was ashamed of his sexual dysfunction, and Martha wouldn't talk to John because she felt he wasn't attracted to her anymore. It's best to communicate and always ensure that you're on the same page. So how do you do this? Think about what is important to you and your partner. Set aside some time together to have a private conversation where you can discuss your thoughts and how to make changes. Make sure you ask your partner how they're feeling and acknowledge their feelings. Some couples find it easier to write a note or a letter to their partner to discuss their needs. And sometimes it can be helpful to see a relationship counselor or a sex therapist together. They can be really helpful in opening the conversation and helping you to enhance intimacy. Now coming back to our toolbox, let's take a closer look at an activity called Sensate Focus. Sensate Focus is an activity for exploring touch and accessing different feelings of pleasure. It was developed as a way to help couples learn about themselves and each other and to move towards a more fulfilling, intimate relationship. The aim of Sensate Focus is to build trust and intimacy within your relationship, helping you to give and receive pleasure. So let's look more in detail. There are 3 different phases of Sensate Focus, and we'll look at each stage. The first one is non-genital sensate focus. This is touching, stroking, or kissing anywhere on the body except the breasts and genital areas. If you are the giver, start with your partner's face, work from head to toe. Take your time and explore every area of your loved one's body. You can explore different types of touch, such as rubbing, squeezing, or tickling if your partner allows it. The goal to experience the sensation of touching. It's not meant to sexually arouse your partner or lead to any certain destination. And even if your loved one gets aroused, do not try to have an orgasm, as it's meant to be an intimacy building activity. After 20 to 30 minutes, or longer if you like, Switch roles. So now instead of being the giver of touch, you'll now be the receiver. And so you can explore phase 1 for as long as you're comfortable with. And after a few times trying that, I recommend moving on to phase 2. If both partners are feeling comfortable, start with phase 1 touching and then move on to phase 2, which is more touching of the breast and genital areas without attempting intercourse. And again, this isn't meant to lead to a specific destination. It's more to access all those areas of pleasure and exploring your partner's body. And the last session can be penetrative sensate focus. During this stage, you will engage in mutual touching, beginning with that stage 1, moving to stage 2, and then, if you're comfortable, getting into position as if you're going to have intercourse. Move your body so that your partner's genitals can rub against yours. And after 1 or 2 sessions, you can progress to full intercourse, or you can stay with touching or oral sex that leads to orgasm. It's helpful to have a lubricant nearby so you don't need to interrupt any action to locate anything. But sensate focus can be a great way of enhancing intimacy, especially if it's been a while since you and your partner have engaged in any of those activities. It's a really nice build-up to accessing pleasure and exploring your partner's body. So here are some tips for engaging in sensate focus. Try not to talk during the activity. Use your hands to guide your partner. Choose a time and place acceptable for both of you where you won't be disturbed, and make the surroundings as pleasant as possible. You know, choosing music, lighting the area, you know, a nice scent, whatever's enjoyable to you. Try to enjoy the journey rather than aiming towards a specific destination. You know, don't rush anything. And often I find the slower you take it, the more you will get out of it. Make sure that you're respecting boundaries. Only move from one phase to the next if both partners agree. So now we'll take a closer look at creating a passion plan, which is another way of enhancing intimacy. And a lot of people like to incorporate the sensate focus activity into their passion plan. Now, what is a passion plan? Dr. Cheryl Fraser designed the passion plan to help couples recharge their romantic and sexual life. A lot of the time, couples tell me that they think sex should be completely spontaneous without ever talking about it. You know, their partner just gives them a look and they should know when you're in the mood. And sometimes that works, yet I find most of the time it doesn't. And especially prostate cancer can change that pattern of how you communicate or be sexual with your partner. Planning passion into your life can make your sex life better, enhancing that closeness you feel together, and it can strengthen your relationship. So here's a quick look at an example of a passion plan. You and your partner set goals for creating more passion in your relationship. And you can do this anywhere. You can write it on a piece of paper, put it next to the bed or on the fridge, wherever you're comfortable. And you can plan for daily, weekly, monthly, and annual goals to enhance your intimacy. And it can be anything that makes you feel closer. If you always wanted to take dancing lessons together, or try a new sexual activity, or just increase the amount of time you're spending together, this can be a great opportunity to sit down with your partner and commit to being passionate together. And it's never too late to show your partner that you care about increasing that connection. And so I've just included a few examples that I always like to tell my clients, you know, like cuddling before bed, daily showing of appreciation. You know, weekly you can have a date night or massage night. You can incorporate sensate focus into your weekly plan. And then some other things can work on your relationship, like attending counseling, going to a workshop together. There's all sorts of ideas out there, and I'm happy to give you more if you need some. So now we'll take a look at ways to enhance libido, as I know that's usually a common concern after having prostate cancer treatment, especially if you're on hormone treatment. So a lot of clients tell me that, Michelle, I've started a passion plan with my wife, yet we're having a hard time following it as, we don't really have the same drive as we once had. And sometimes treatment or age and other life challenges can change your sex drive, and that can make it challenging to be sexual with your partner. And when that drive is low, or if you're having changes to your sexual functioning, initiating sexual activities can be so overwhelming that we don't even want to start them. Remember John in the initial story who had some issues with sexual functioning, specifically erectile dysfunction, and he thought, why even start something I can't finish? Remember, appetite comes while we eat. It's the idea of starting intimate activities without pressure to arrive at a specific destination, such as intercourse or orgasm. Most of us have experienced a lack of appetite where the idea of being expected to eat a large meal can be pretty overwhelming. So imagine you come home and your partner has made your favorite meal. And for now, we're going to use my favorite meal, which is pizza. So now you see this very large pizza and you think, I'm not really feeling hungry, yet I'll try a few bites. So the more you eat, the more you think, wow, this tastes really good. I'm gonna keep eating this. And soon you finish the whole pizza and you're having dessert. When our sex drive is low, or if you have changes in your sexual functioning, the thought of initiating sexual intimacy can be overwhelming. Yet starting slow and being open to trying new ways of intimacy together can be very pleasurable and bring you closer. So the next time your partner mentions having sensate focus night or trying a new sexual aid, try taking a few bites and see where your sexual appetite goes. You can still access joy and pleasure in being sexual with a low libido. Another way to increase your libido or sex drive is called simmering. Simmering is the process of nurturing a conscious thought around something that is sexually appealing to increase your sex drive. So when you go to engage in sexual activities, your mind will be turned on, which can increase arousal. So let's talk about that more. Say you are planning on having a sexual activity this Saturday night, either by yourself or with your partner. And on Saturday morning, you start to think about a very pleasurable sexual thought or experience. And this can be a previous sexual encounter. It can be from a book or a movie or simply just a fantasy. And throughout the day, reintroducing that thought back into your mind, like simmering that thought. Then when you have that sexual encounter, you'll have that sexual thought building in your mind. And many couples find it pleasurable to send sexual text messages or notes throughout the day. This can be a great way to build that sexual tension. You know, watching TV or reading erotica can sometimes help too. Find out what works best for you, as there are many options out there to stimulate those sexual thoughts. So next we'll take a look at something called mindfulness, which can help improve intimacy as well as feelings of masculinity, sexuality. It can help relieve stress and improve depression. The mindfulness is derived from a Buddhist practice, and it's based on meditation techniques. The practice focuses on your ability to be aware of your thoughts, emotions, physical sensations in the moment without any judgment or criticism. And it's proven that mindfulness can help reduce stress and anxiety. So how do you practice mindfulness? Mindfulness is a form of meditation, so you can sit in a quiet, comfortable space and focus on concentrating on your breathing. You can take a mindful walk, engage your senses, notice the sights, turn off your brain, notice that smell, the feel of the world as you move through it, and pick your favorite place. Somewhere you find peaceful, such as a forest or a beach or in a park. There's also quite a few apps out there on cell phones that can contain guided mindfulness sessions. Smiling Mind is a free one that you can explore, or simply just searching guided meditation session. You can also do that on the computer. There's lots of websites, and I'm happy to direct you to those if needed. A lot of adults like coloring. That's kind of all the rage these days. It's a great way of turning off all those thoughts and feelings and just focusing on one thing at a time. And then having a mindful shower or bath can sometimes help too. The primary objective is to bring your attention to experiences, thoughts, and feelings that occur in the present moment without judgment. So now finally, we'll take a look at some of the erectile dysfunction treatments. And this will be a brief overview to show you some of the options as we do discuss them in the clinics. I know I discussed them in the sexual rehabilitation clinic, and I know that Lana would be happy to discuss that with you as well. So I'll just quickly kind of go over some of the options so that you're aware of them. And then if you need more information, feel free to let either of us know. And so looking at the oral therapies, the pills, is usually the first thing men will try, as they're kind of considered the easiest treatment and least invasive. They're called PDE5 inhibitors, as they work by inhibiting an enzyme, PDE5, which causes smooth muscle in the penis to relax, allowing more blood to flow, forming an erection. Now, there are 4 different types I have shown here on the screen, which is Viagra, Cialis, Staxin, and Levitra. They all work similarly, as they are the same classification of drug, meaning they all kind of work the same. However, some men respond better to one than another, or some men have side effects with one and not another. So for example, if one person tells me that they're taking Viagra and noticing a headache or stuffy nose, I might recommend that they try Cialis, and sometimes that'll kind of work better for them. So it's good to try them all, not at the same time, to see which one is the most effective for you. One thing to consider though is that if you have any heart conditions, say if you're using a nitro spray or if you have very low blood pressure, this may not be the best choice for you. These medications can lower your blood pressure. So if you're already taking something, that might cause some issues for you. So make sure that you always talk to your doctor before starting one of these medications. And so the Viagra, Levitra, and Staxin are called short-acting medications, meaning they stay in the body for 4 to 8 hours. The Cialis is a long-acting medication, sometimes called the weekender, as it can stay in the body for 24 to 36 hours. And always remember to have good sexual thoughts and stimulation when taking the pills. You may be familiar with the old Viagra commercials where, a man takes a pill and suddenly he walks around and has this great erection. Unfortunately, they don't work that way. They're not magic pills. You have to be in the right mindset for them to work. Now taking a look at Muse, this is a tiny pellet or suppository, which is about the size of a grain of rice, which is administered into your urethra, which is the same area as where a catheter would go, using a small applicator. And most men are kind of turned off on this because they may have had a catheter if they had surgery or treatment, but just know that it's actually quite well tolerated and it's not painful. It's not commonly used in Canada as it's quite expensive, about $40 to $70 per one application. And it only works in about 40 to 60% of men. That being said, men in the UK love using Muse as it's covered in their healthcare system. So just know it is definitely being used and enjoyed. It can give a really good quality erection with about 10 to 15 minutes. It is not appropriate for all patients though, especially if you have any urine leakage, which is common after having a prostatectomy, as if there's any urine leakage, the medication won't have time to absorb properly, so it'll just be flushed out with the urine. And the next is penile injections or intracavernosal therapy. It's one of the most effective erectile dysfunction treatments, about 90% effective, and it's also one of the most affordable therapies, especially when compared to the pills, as the pills are quite expensive. It's a very local response, so you inject a very small amount of medication into one side of the penis, which causes that smooth muscle to relax and allows blood to flow in, forming an erection. You only need to inject once on one side of the penis to form a full erection. And it produces a good quality, long-lasting erection, ideally lasting 30 to 60 minutes, or however long is pleasurable for you, but definitely under 2 hours. A lot of men are hesitant to try penile injections as they're afraid it might be painful, or a lot of people have that needle phobia. But I'll just show you, it is a small needle. It's one of the smallest needles that we can use. It's actually an insulin needle. And I've never heard a man complain that it's been painful. Most men don't even feel it. The most challenging part of the injection is psychological and being comfortable with the technique. And so I do one-on-one teaching in the clinic where I can show you and your partner about how the medication works, how to drop the medication, holding techniques, injecting, all that kind of thing. So if you're interested, definitely let me or Lana know. Yeah. And then we also have a vacuum pump device. It's 80 to 90% effective when used correctly. It can take a bit of time getting used to it, which is why if you do purchase a pump, I recommend using it on your own without a partner for 14 days total and using it daily, as it does take some time to make sure you're opening up those spaces properly and getting the right technique. A lot of men like using the pump as it is considered a little more natural without medication. They also like how you can use it for two purposes. That can be for something called penile rehabilitation, which is doing exercises to keep that penile tissue healthy. And you can also use it for sexual activities, whether that be self-stimulation or masturbation or with a partner. And so you can use it with medications though, if you want to take it with the pills, you're welcome to do so, as some men find that they do have a better response with the combination. But basically how it works, I have my medical grade pump here, is that the penis goes in the tube, and when you start to pump, a negative pressure removes all the air in the cylinder. The negative pressure pulls blood from the veins and arteries in the penis. Some men like to use what's called a tension band, as that can help maintain your erection, as often men will find that they go to do their pumps and then form an erection, and as soon as they hit release, then their erection will be gone. So using a band can help to keep the blood in the penis to maintain that erection. But just know that you can only wear a tension band for 30 minutes at a time, as we just want to ensure that the penis stays healthy. So some tips for using a vacuum pump: make sure that you have a good haircut, so trimming any pubic hair around the base of the penis, and using a lot of water-based lubricant. This is the one that comes with the medical grade one, but you can get lots of water-based lubricants from adult love stores or even from pharmacies. And there's just a few considerations when using a vacuum pump device. The erection can look a little different. It might look a little dusky blue and be cold to touch. This is from drawing in blood from the veins, which doesn't normally happen too much with natural erections. It's not harmful to have blood coming in from the veins. It is just kind of distressing if you're not aware of it. So just know that that can be a bit different. So I always tell couples, you know, if you're kind of bothered by that cool touch or dusky color, simply put a bit of lubricant in your hands and you can roll the penis to kind of warm it up a bit. Another consideration is that there might be a bit of a hinge effect. This is because the blood is only maintained in the base of the penis. So if you're using a tension band here at the base, it'll only be firm up into the shaft to the tip. And normally you will see an erection will be firm deep into the pelvis. So you just have to be a little careful with positioning, as there is that little bit of a hinge effect. And we can definitely talk about that more if you need some more information about what to do. And then finally, we also have the penile implant. This is usually considered the last resort, as it is a permanent option. So once you have the implant, you can't decide to go back to the pills or injections or the pump. That being said, a lot of men do enjoy having the penile implant. It has a 90% satisfaction rate. The procedure is a day surgery. It usually takes about an hour to an hour and a half, and it is fully covered by our healthcare system. So for the 3-piece model, which is shown here in this picture, there is a pump in the scrotal sac, a fluid reservoir in the pelvis, and then 2 cylinders which replace your erectile bodies in the penis. So after you have your surgery and once healed, your doctor can show you how to cycle it, but basically it goes pump, 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 erection. Every man's kind of different with how many pumps they need. And then the erection will be consistent and firm. And after climax, or when you're finished, you push a button in the scrotal sac to release the fluid to go back into the saline reservoir. So as I said, doctors usually wait a while, typically 2 years after having prostate cancer treatment, before they'll kind of explore this option, as they want to ensure that you have achieved the best possible recovery for natural erection. One thing to consider is that it does not extend the length of your penis at all. So if you're wanting to know how long it would be, if you just extend your penis out flaccid, so in its softened state away from your body, that's the size it would be with the implant. The erection would not be as natural as you would normally see because of that lack of engorgement. And also the tip of the penis would not be firm. Most of the rigidity is within the shaft or body of the penis. So definitely let me know if you have any questions or concerns about any of those treatments. And I highly recommend you come to my other education session, which is about sexual functioning and rehabilitation, where we kind of talk about those more in detail. So here are some key points to take home from this presentation. It's important to communicate, have more open conversations with your partner, listen to what they say, try not to interrupt. Practicing that active listening is important. Schedule some time together with your partner for just the two of you. Intimacy is whatever you do together when you're alone. Try writing a passion plan to have more of that intimate time together. And tell your partner that you love them and appreciate them every day. Even something as simple as a text message, a little note, or a quick reminder can go a long way. And then enhancing your intimacy with more physical contact. So having that 30-second hug every day, cuddling, kissing, hand-holding, anything that makes you and your partner feel good. And remembering that your partner is there to support you. Don't be afraid to let them know how you're feeling, as chances are they may need your help as well. Everyone needs help sometimes, and that's okay. So I belong to the Prostate Cancer Supportive Care Program within BC Cancer. Here is some information about our program. We offer education sessions, clinical appointments, and have a research component in our program. And I've just highlighted or bolded the ones that I'm presenting, mainly about sexual function and intimacy, which is a little different from this presentation, as well as managing side effects of androgen deprivation therapy or hormone treatment. And so for Module 2, our next session is July 21st at 2:30. And for Module 4, our next session is July 14th at 2:30. So definitely let us know and get in touch with us if you're interested in one of those or any of these education sessions. And so here's our contact information. Please feel free to contact me with any questions or concerns at any time via phone or email. You can also contact our lovely program coordinator, Jessica, if you're interested in signing up for an education session or need more information about the program. And so I'll stick around for a few more minutes. If you have any questions, please let me know. Otherwise, thank you so much for tuning in today. I hope you found this presentation helpful in learning about a few ways to enhance intimacy and adapt to sexual changes. I hope you have a good night and stay safe out there.